anything else that has come out in the last week that practices should know about? What have you been hearing?
Well, we always have that nugget at the end of our video interviews about what has been the crisis in the last 7 days since the last episode of In the Sterilization Room.
Right.
And the crisis now that practices have reopened is employees that are either exposed to COVID-19 or diagnosed as having a COVID-19
Mhm.
infection. And now offices are scrambling and going, what do we do? What do we do? And we've talked about what the CDC guidance is. And CDC, when we go through for dental practices, refers to employee healthcare professionals that are exposed or diagnosed with COVID-19. And we'll bring up that page on the video, if you will, and give all of the viewers a link to that page.
Yeah.
So CDC basically says, if you're exposed for, say, longer than 30 minutes to someone that you later found out was diagnosed with COVID-19 and you weren't wearing a mask during that time, that you should self-quarantine for 14 days.
Mm-hmm.
Or if you do an aerosol procedure and maybe 2 days after you took off that patient's brackets,
Mm-hmm.
you did a Devon procedure, and then you do the follow-up call. The front desk calls the patient, says, how was everything? How does it feel now that you've got your braces off? And no COVID-19, have you shown any symptoms? CDC asked us to do that, to require, and they go, oh yeah, 2 days later, I have a fever of 102. Oh, now they've spent time with that with that patient.
Right.
And they did an aerosol generating procedure. They picked up a handpiece with it. So now you've got to go through the triage with an employee about what to do. And offices, they need to find out from their local health department what are the current recommendations. And that's going to vary depending on how many new infections have been diagnosed.
Yeah.
Are you seeing a surge, a new wave of infections in your area? This morning I heard California, Texas, Arizona, and Mississippi were in that high numbers that are arising. So we are going to see an increased number of infections, and different health departments, different states have varied recommendations from maybe a week afterwards to 10 days to 14 days, like CDC has. So you really, the office is going to need to contact their local health department, but you also want to know a place that you can go look at. And one of my reliable sources for human resource information has been Bent Erickson Consultancy. And I think we can put in the link there, because they do have a page of frequently asked questions about employees who are exposed. And when you look at what are the human resources laws that govern this, it can be varied, such as, did the office participate in the Families First business arrangement with it, the FICRA, because that determines if that employee has to be off for 14 days and quarantined, they don't come to work, do they get paid?
Right.
Will unemployment pay them? Or will it have to come out of their PTO? And that's not my area of expertise, human resources law. And Bent Erickson is a reliable, long, nationwide consultancy that I've always referred my clients to. And as I said, they're nationwide, but they will still provide the information specific for each state. And that's what we need. So when you go to that page on frequently asked questions, you can click on the link that'll take you to the health department or to the state laws with it. So you do need trustworthy resources. And I know some of my offices have even contacted their attorney that they have for the orthodontic practice when they run into a situation like this, to say, what are our state laws? What do we need to do? So it's complex. There's a lot of different government agencies that are involved in our orthodontic practices.
Yeah, no, definitely. Well,